We were created because 10 million people die every year from lung disease, even though many of these deaths can be prevented. Focusing on the major causes of lung disease can make a huge difference. Tobacco use, for example, will kill 1 billion people this century if trends continue. World Lung Foundation is a global leader in creating effective, large-scale public education campaigns that move people from awareness to action for tobacco control. In addition, while we don't yet have all the answers to indoor air pollution caused by cooking with wood, dung, and other materials, it's clear that new technologies to help solve this problem are not far off, and we are helping to move them along. Broadly speaking, we are looking to strengthen global commitment to lung health, especially in tobacco and air pollution control, and we're keen to influence global health policy. For example, the United Nations is currently defining its next iteration of Millennium Development Goals, which will guide government priorities for decades to come. It's critical that lung disease and prevention be included in these goals, and we will be actively engaged in making sure this happens. We are also working to scale efforts that have proven successful. Financial stewardship and project management are core strengths of ours, which is why we have been entrusted with over $250 million for grants in dozens of countries around the world. Beyond ensuring that funding is spent wisely, we emphasize program evaluation that measures the success of every effort. Our own programs have been in the forefront of social marketing for global lung health. World Lung Foundation has conducted more than 100 campaigns in 22 countries since 2007, reaching more than 1 billion people. 2/3 of these have directly supported changes in health policy and legislation. The magnitude of the problem means that we can have a major impact. That's valuable in terms of donor investment and priceless in terms of lives saved. We succeed for 3 reasons. The first is that we hire and partner with talented people. We have a knack for spotting, nurturing, and keeping them. Our staff comes from diverse backgrounds in the private sector, government, and civil society. Insights from different worlds means we are constantly learning, challenging each other, and applying our shared experience to what we do. Second, we are laser-focused on the evidence for any given initiative. If there's no evidence for new intervention, we seek to establish that evidence, which will inform a better effort next time. Third, we're not afraid to fail. We know that not every effort will be 100% successful, but we also know that if we measure what we do, we improve our impact. Generally, we measure success by the number of people who are impacted by our work. That may be the number of people affected by policies we support, the number of people who have seen or taken action because of our communications campaigns, or due to our sound financial and project management. We also measure our influence. Because lung health is often forgotten, it's critical our voice is heard by politicians, journalists, academics, the medical profession, and the general public. At times, we're confused with our partners or our grantees, such as the International Union Against Tuberculosis and Lung Disease, or with the American Lung Association. In fact, we are a far newer and leaner organization than both. We aren't big, but we're agile. We don't offer medical services to the public, but we work on prevention at the policy level. We often work behind the scenes and allow governments and our country partners to take ownership and to benefit from the visibility of a program's success. More than 1 billion people have seen our mass media campaigns warning about the harms of tobacco. This is an important metric in the countries where we work, as the profoundly harmful effects of smoking are well established but not universally known. For many of those exposed to our campaigns, it's the first time they've seen a graphic depiction of what tobacco does to their own bodies and to their loved ones. Just as important, we've helped establish rigorous scientific evidence and highlighted campaigns that work by publishing results in peer-reviewed medical journals. Like many successful startup organizations, we've grown very quickly. We want to invest in expanding our strategies that will bring life-saving programs to more of the people who need them the most, with a continued focus on lung health. We also face the tobacco industry everywhere we go, an adversary with deep pockets, 100% global reach, marketing acumen, and a relentless drive to increase its customer base. Tobacco kills almost half of the people who use it, so the industry must secure new customers to replace those lost. First, in many of the countries where we work, knowledge about the harms of tobacco is where the United States was 50 years ago. We know from our experiences here what works. More resources will help us build programs that accelerate education and change, and encourage governments to take up the evidence and invest in their own future. We want to continue our mass media campaign work in the 15 countries with the largest number of smokers, and expand to another 10 countries where hundreds of millions of people are still uninformed about the dangers of tobacco. Second, we see great potential in advancements for indoor and outdoor air pollution. We're beginning to analyze existing data and call attention to policies that need to be implemented to start the world on a path to cleaner air and better health. To date, we've focused our efforts on the leading causes of lung disease. We believe there's a role for an organization like ours to lead in the area of outdoor air pollution, caused largely by factory production, transportation, and other factors. It's a problem that plagues people all over the world, adding to a tragic burden of asthma and pneumonia in children. We believe that there's a solution to this global problem, and that we have the experience and energy to make an impact.